Welcome to the Energy Blueprint Podcast. I'm your host, Ari Whitten, and today I have with me Dr. Jolene Brighten, who is one of the world's leading experts in women's medicine and is a pioneer in her exploration of the far-reaching impact of hormonal birth control and the little-known side effects that impact health in a big way. In her best-selling book, which I have here next to me, Beyond the Pill, she shares her clinical protocols aimed at supporting women struggling with symptoms of hormone imbalance, including post-birth control pill syndrome and birth control-related side effects. A trained nutritional biochemist and naturopathic physician, Dr. Brighten is the founder and clinical director at Robust Health, an integrative women's medicine clinic. She's a member of the Mind Body Green Collective and has been featured in prominent media outlets such as Forbes, Cosmopolitan, ABC News, and the New York Post, and most notably, the Energy Blueprint podcast. Add to the list. So welcome, Dr. Brighten. Such a pleasure to have you.
Hey there. Thanks so much for having me.
Yeah. And before we get into it, I want to personally recommend, obviously I'm reading this book, Beyond the Pill, not because I'm on the pill, but as one, in preparation for this interview, and two, for the knowledge gleaned to help, the women in my life, whether it's my wife who was on the pill for many years, or my newborn daughter. I want to know this information to keep them safe. So for everybody listening, whether you are a woman, whether you have daughters or you're a man and you're looking out for your wife or your children or friends, I highly recommend getting this book and reading it. You can get it on Amazon. I have no vested interest in telling you to do that. Just go to Amazon and grab it. It's really important information. So, Dr. Brighten, let's first start off by talking about what this book is all about. So why did you write it? What prompted it? I know you have a personal story here, but then you dug into the science after that personal story. So tell me a bit about that.
Yeah, well, you've written a book and you only write a book if you can't not write the book. Like if it's like it just is bursting to get out of you. And, really what inspired me to write this book is that I was finding myself having the same conversations with my patients over and over and over, and then being reached out to with interviews and articles. And I'm like, okay, there are a lot of gaps that we need to fill. And, I spent 10 years on the pill. So I'm a first generation college student. So whenever people are like, you're obviously anti-birth control and you're anti-pharmaceuticals, I'm like, well, one, I got to graduate college and this was a tool I used to do it. So I'm super grateful for that. And it got me out of those incredibly painful, terrible periods I was having. And two, a little known fact about me, I have Hashimoto's and I take a medication every day for which I'm grateful for. So I'm not anti-pharmaceuticals by any means, but really it's about pro-informed consent and making sure that women have all the information they need so that at the end of the day, they feel like they made the best decision for themselves and that they were well equipped to go to their doctor's appointment and have that educated discussion. I had myriads of birth control side effects that I only look back now and I'm like, oh yeah, like that was probably because I was on the pill. You mean a 20-something never having libido wasn't normal? Like, oh, that's because I was on the pill. Like, there were times that I was on formulations that caused, extreme depression. And I was told it probably wasn't that pill, but let's just switch and see what happens. And then I was a different person. And what did my teenage self know about that? Like I had no idea. And so a lot of this book is, the focus is, really turning up on the lights on what we do know currently with birth control and then asking a lot of questions about what we don't know. Like saying, for instance, we know there's a correlation between depression and anxiety and starting hormonal birth control. But what we don't know is why does it happen to this woman, but not this woman? Like, why is it one sister can take it and it's fine? It's the best thing ever happened to her. And then the other gal, no, like it's one of the worst things that she's ever gone through. And so, writing this book was about putting the information in women's hands, but also getting the medicine in their hands and reminding them that what it takes to stay out of the doctor's office, you don't find it in a pill bottle. Well, you really find it at the end of your fork. You find it the way you talk to yourself when you get out of the shower. Women, and, a lot of the lifestyle therapies. And so it's called Beyond the Pill because I wanted to give women root cause solutions to their common hormone issues beyond birth control. They always have that option, but what else could it be? What questions could we be asking and what could we be investigating? And how can you work with your your doctor. And it's also beyond the pill because so many women that I have met with and I've talked with online are terrified to come off of birth control because, like the majority of women, they were using it for symptom management, and they're so afraid that when they come off, those symptoms are going to be way worse or something unknown is going to happen. And so I wanted women to know there is life beyond the pill, the patch, the ring, the IUD, any of these things. You can work with your body. And if you do choose to use birth control, you should have all the information and support to stay healthy and safe on it.
Mm-hmm. Now, I want to start with just a couple facts around this that may surprise a lot of people. One of the facts that I read at the beginning of your book is that a majority of women take birth control pills not for birth control. So
crazy, right?
right. So talk about that. What are they really taking it for, if not birth control?
Yeah, so pregnancy prevention is what it was developed for. However, over time, we've come to see that more and more women are being prescribed the pill for things like acne. So that could be just benign acne, as in you have a few zits here and there, or cystic acne, which we see often with like polycystic ovarian syndrome. Painful periods, so having extremely painful periods, or even wanting just to skip your period. So some women are using it because they find their period messy and inconvenient, and like, this is 100% you're right to use it for these symptoms, but we have to recognize that a lot of these symptoms have an underlying cause. So if you are wanting to shut down your period because you bleed for more than 7 days and it's super heavy, we need to ask, do you have iron deficiency anemia or estrogen dominance or fibroids? Like, is there something else going on? We also know that the younger you're put on it and the longer you stay on it for painful periods, the more likely you are to receive the diagnosis of endometriosis. This is not that birth control causes endometriosis, just like birth control doesn't cause PCOS, but it can mask it and delay a diagnosis, which is a big problem because endometriosis is one of those conditions that we see the highest incidence of infertility. Polycystic ovarian syndrome, while it has these unwanted hormonal side effects, so another reason why we might want to use the pill is because we're growing hair on our chin, chest, abdomen, and we don't like that. Like, this is not something that women generally like, so I don't blame them. But if you're using it for these symptoms and yet not addressing what the underlying cause is, with PCOS, for example, you're allowing inflammation to progress, cardiovascular disease to progress. Hormonal birth control increases cholesterol. It can elevate blood pressure and lead to insulin resistance, and down the line that becomes diabetes. Women with PCOS are already at high risk for this. So this is the information that we need to convey to women, is that if we're going to manage your symptoms with the pill or any other form of hormonal birth control, we do also need to know why you have them to begin with, because this is actually part of why I wrote the book as well and started talking about this so much, is that I was really fatigued on being the doctor telling the 30-something-year-old woman that she had PCOS or endometriosis, and this was why she couldn't have a baby, and that this was allowed to progress. And, her looking back and saying, like, why didn't anyone ever tell me this? And I thought to myself, yeah, why are we not talking about this? So, there's a lot of symptoms that can come up, even like hormonal headaches, that doctors may reach for the pill for, because if you shut down the reproductive system, then you can shut down the ebb and flow of the hormones, because we are cyclical creatures, and that will get symptom relief in some conditions.
Mm-hmm. Now, I want to speak to that point just a bit, because it seems to me like there's a gap in conventional medical doctors' thinking on this issue, where every symptom, or almost every symptom, that is a deviation from normal, sort of very little symptoms as far as associated with the monthly menstrual cycle, is a reason to give birth control pills. So whether it's painful periods, whether it's heavy bleeding, whether it's irregular periods, whether it's lack of period, it's like it seems like they're throwing the pill at almost all of these kinds of issues without further exploration. And this is a point that you harped on a lot in your book, where, as you said a minute ago, like, if you have heavy bleeding, it may be a sign that you have, for example, anemia, or it may be a sign of this, or if you have irregular periods, it could be this, or it could be that. So I'm just curious why you think that they're not addressing some of these deeper root cause issues and they're just rushing to prescribe the pill.
One thing I think about is that if you believe that you have got the cure-all for everything female related, so I call it the pill for every female ill, and it will help this woman, why would you hold back? Why wouldn't you prescribe that for her? If you think this is the tool and I can fix what ails you, of course you're going to prescribe that. But, I was talking with a conventionally trained medical doctor, and he said something really interesting to me. And that was, whatever we're taught in residency, it doesn't matter how much research comes out. It's very hard to get us to change our mind after that, because he's like, it's not just the indoctrination, but it's what we go through mentally and physically during residency that almost breaks us in a sense, to where it's like, we accept this. And he had approached me for this conversation after hearing me talk about, like, there's diet dogma, there's medical dogma, and we need to move away from it. Like, we need it. It is okay to have beliefs, but we need to acknowledge when we have a belief and when we have science. Like, there are times in my book where I'm like, I believe this might be the case, but I don't have a study for that. So like, we can just admit that. But it is something that I think, when we recognize, as I talk about in the book, women just got started to be included in studies just a handful of decades ago. There is a medical gender bias that exists, so well recognized that we see major medical institutions like Harvard are starting to change their curriculum to match this. And this bias is against women. Women die of heart attacks at a higher rate because we're dismissed. We are less likely, statistically speaking, to receive adequate pain management care because we're often told things are in our head. And it's kind of a throwback to the days of hysteria. And not a lot of people know this. I love old school medical books. I love I'm talking like you have to have white gloves to touch them. On my honeymoon, my husband took me to a rare book room with medical books. I love to go through and just see the evolution of medicine. And when we look at the evolution of women's medicine, I mean, there's so many things that have been done, like sedating us and, prepping us and cutting us and pulling a baby out with forceps, and like so many things that have been done in a way that really is more like, we're going to conquer the female body rather than work with the female body. And it's really and I just want I want to be clear that I'm not hating on medical doctors, and I'm not hating on anybody, because like, this is how medicine and science evolve, is we do dumb things, and then we're supposed to be humble enough to look at it and be like, maybe that wasn't such a good idea. Let's do something different with that. But, in all of this, I really wanted women to walk away from this book understanding that their symptoms are not their body's way of betraying them. It's not your body. I've said this before. Your body's not a vehicle just trying to get you to the finish line, which is death. Like, it's in it with you. And your symptoms are your body's way of speaking up. Like, when we come off of birth control and all of these symptoms arise, the different systems are trying to speak to us and say, hey, I love you. I'm with you. Please pay attention to this. And the symptoms are an opportunity to heal. When they start out as cystic acne now, may very well become diabetes and heart disease in the future. But that cystic acne is an opportunity to be curious, to do the lab work, and to work it up. And I think, to be fair with doctors, women don't always come in with the best quantifiable data. They'll come in and just say like, oh, I'm in so much pain and I bleed all the time. And their doctor's like, okay, that sounds like every woman I hear, which is another, part of it is like, who goes to the doctor but sick people and people who want help. So if your doctor sees that day in and day out, that's normal to them. But it's just common. It's the common chief complaint, as we call it, that comes in. But, in that, if you go to your doctor, and that's what I aim to do in Beyond the Pill, like, you say your clots are bigger than a size of a quarter, that your doctor's going to be like, that's okay. That's interesting to me. You say that like, okay, when my period comes, the pain is on this scale. It's an 8 out of 10 and I vomit. And when I bleed, I change a tampon every hour. Like, when we go in with quantifiable data, we start speaking the doctor's language. Now, this should have never been put on a patient to have to figure out how to talk to doctors. And doctors are trained to talk to patients, but there is a gap right now in women's medicine. And so Chapter 4 of my book is what I call the period decoder ring. Like when the day you got your period, someone just said, congratulations, here's the decoder ring of all your symptoms and what they mean. But in that chapter, we troubleshoot some of the most common, what we call period problems. And then I give you okay, so listen, this is what it might be. And this is what you can do right now. Well, you wait for that doctor visit, or you wait for those labs, and go to your doctor with that curiosity of like, I appreciate that you're offering me the pill. However, Could it be X, Y, and Z? What do you think about doing a transvaginal ultrasound? And it's really when we approach doctors in this way, we're much, much more productive, because the problem is that we're sick, and we're in pain, and we're frustrated, and then we yell at our doctor because it's like the sixth doctor, and then we forget they're humans. And what do humans do when you yell at them? Fight, flight, freeze. Your doctor's going to run out of the room, or they're going to shut down, stop listening to you, or they're going to push back and tell you, like, you're going to do X, Y, and Z, and it's just the way it is.
Mm-hmm.
And I would love to be like, oh, doctors are special creatures. No, we're humans at the end of the day. And so, I think there's a lot of disconnect in terms of respect for the patient's story and bridging that with the science. And a lot of the times doctors get told if there's not a story to support what she's saying, or she doesn't fit the perfect algorithm, then she might be making it up. Like, it may not be real.
Yeah. I like what you said earlier about, kind of this feeling like we've conquered the female body. I think because this monthly menstrual cycle in a way has been so mysterious historically. And there's all of these, I think, what men have historically perceived as really weird, irrational symptoms, and like, oh, she's PMSing again, and she gets kind of irritable and cranky and a little crazy. And I'm just wondering to what extent birth control has almost been seen historically as like, we finally conquered the female body and we've stabilized them of their irrationality,
Oh yeah, I think there is an undercurrent, in that. I don't think anybody would verbalize it or say it out loud. I think in the current culture, people would be, put a little pause on that. But, from a business perspective.
Well, I just did, so I took care of that.
Yeah. But, from a business perspective, birth control is a really interesting pharmaceutical, because it was the first time a drug could be prescribed without having a diagnosis. So you didn't need a diagnosis, and you didn't need to be sick. And in fact, we could put every single woman who went to college on it. And it very much, it's really interesting in all of this. And Holly Grigg-Spall wrote a great book called Sweetening the Pill. She's a journalist, so it's from a journalist perspective. And she was talking about how, the first wave feminism around the pill was actually not to take it. And women were protesting it because they were so sick, and because women were dying, and because the trials were really shady. I mean, there were doctors, so female doctors, who were basically told, you can't stay in medical school unless you are in this trial. You must be in this trial. And women would try to hide taking it and not actually take it. And the interesting thing about that is we can verify it by measuring binding globulins. So sex hormone, cortisol binding, and thyroid binding globulins are all elevated while you're on birth control. So and that's going to affect all of your hormones, by the way, for people listening. So whenever doctors are like, it doesn't impact the thyroid or the adrenals, like that can't be a thing. And the testosterone thing's not that big of a deal. And I'm like, except those binding proteins are exactly how we verify you actually are using it in the trial. But, I will say, I think that it's absolutely been instrumental in the women's movement. I mean, there is data showing increase in wages, increase in college graduation among women when they introduced hormonal birth control, and they were able to attribute some of that to the pill. So it has been really helpful. But as women have come under threat to lose access to birth control, which has happened over and over and over, it is something where there's also this pushback from what would be seen as a pro-women side, saying, don't question it because we might lose it, and don't question it because you should be grateful that you have it. Just take it and say thank you. And yet, what I advocate for is that we can advocate for access and education and informed consent all at the same time. I call it having it all. You can have access to birth control, but you can also you can have individualized counseling with your doctor, and you can also know what the risks are so that you can monitor and know when to go to your doctor.
Yeah. Now let's talk about what some of those risks actually are. So I know you've alluded to a few different things here as far as hormonal disruptions and thyroid issues and autoimmune issues, libido issues, and there's several others that you mentioned in passing. But can you kind of give a quick rundown, a list of, the most strongly supported in the evidence problems or negative side effects that can arise from using birth control?
Well, the one I talked about to begin with, that we only have causation studies, correlation, y'all, just scratch that. Please don't misunderstand me. Oh my God, that's like the worst thing to say, right? When you're talking research, we only have correlation, not causation studies. Is the effects on mood, and so depression, anxiety, mood swings, increased suicidal ideation. So younger women, they're at higher risk of committing suicide when they get on birth control, and this is not just the pill. This is also progestin based. So like IUD is the mini pill, which we usually give in postpartum because it's lower risk of stroke, and clots, which is a risk factor, very well supported in the research. But with these depression studies, the thing I do want to honor is that since the introduction of birth control, women have complained of the mood alterations. And in fact, it's in the packages. The pharmaceutical companies put it in there as a potential side effect. And in addition, to women having complained about it for so long, we've also come to see some research coming out about what the mechanism of action may be with that. Like it alters the structure of the female brain. It messes with the tryptophan pathway. So our tryptophan metabolism doesn't quite go into serotonin and instead goes into neurotoxins. And, through all of this, we're getting closer to understanding this, but there's still a lot of people dismissing it. And it fascinates me how many researchers, so MDs and PhDs, researchers have been coming out saying, for as long as birth control has been on the market, we really haven't done our due diligence in studying it and studying everything that's going on. So what's really important, I think, to understand is that birth control works on the brain. That's where it works. And I didn't know this for 10 years. I was like, I just took the pill and I was like, yay, I'll have a period when I want to have a period. This is great. And, but in that, whenever I hear someone say, well, the birth control can't have any effect on the brain, I'm like, can we talk about how it works? Because the way it works is to flood your system with so many hormones, it stops your pituitary from signaling to the ovaries, which is a very good thing if you don't want to ovulate and you don't want to have a baby. But to say that it can't have any effect on the brain, that can't be accurate, especially because we know that natural estrogen and progesterone, there is no progesterone in any hormonal contraceptive. So everyone listening, it's only progestin. It's synthetic. It doesn't have the same benefits. But these hormones are absolutely neuroprotective. They help with neuroplasticity. They help with memory. There's so much that they do. And to understand that if every single cell in your body has receptors for natural hormones and we just flooded you with synthetic hormones, they have the potential to cause some issues as well. Now, we talked about a little bit, like clots are definitely a risk and it depends on the formulation. It also depends on your own genetics. And this is something that the hardest chapter of my book to write was chapter 8, which is the reversing metabolic mayhem. And quite honestly, I just don't enjoy talking about cardiovascular health. It's just not I'm like, but also it's scary. When you start talking about heart attacks, strokes, having a pulmonary embolism, cancer, diabetes, it gets scary quick. And I did not want to scare people in my book. And there's parts where it's like, okay, this is scary. Like, let's admit it's scary. And yet, like, I also outlined, if you're scared, get these lab testing done right now. So something like a factor V mutation. It's interesting is that I recently was looking up some research on a particular pill formulation. I was writing an article of like, okay, everybody's going back to school. People are going to college. I want to write an article on how to stay safe on birth control so that women know and they have that tool. And to see that one formulation of the pill in this medical database, that's a conventional medical database, said, here's the contraindications to women using the pill. And then it said Canadian. Here's the Canadian ones. And it started talking about MTHFR and homocysteine levels. What I talk about in my book, that people have told me I'm crazy because in the US, we don't regard that. I'm like, wait a minute. Why is this the same pill? Women are not different from the US and Canada, yet in Canada, we're using more caution around that than we are in the US. So there's these other continental disconnects that happen as well that we have to start looking at. So MTHFR is definitely something I talk about in my book, getting tested. No, it's not because you need boatloads of supplements or that your genetics rule you, but it's because it could put you at a higher risk for a cardiovascular event. So it's best if you have that to follow up with additional lab testing and understand one, what's happening in your body, and two, what is actually happening in terms of you being on the pill. Mm-hmm. Now, The research around gut health, I don't know if you've seen any of this research.
In your book, I saw you talk about it,
Is
but
it blue?
I hadn't seen it up until that.
It blew my mind when I got, so, I really got into that because I found that, okay, there's patients of mine that, they would be able to heal their gut, like maybe 80%, but we couldn't get to that 100%. And what is going on? And, they were all on the pill. And I'm like, that we're not all, like, not everybody who has trouble healing is on the pill, guys, but these patients were on the pill. And I'm like, well, let me look at that. Well, what we've known is that it does contribute to dysbiosis. In fact, dental research has shown overgrowth of yeast in the mouth since the introduction of the pill. We know vaginal yeast infections increase. It's definitely a risk being on the pill, but it also causes dysbiosis in the gut and intestinal hyperpermeability, which most people are more familiar with as leaky gut. Which, when I read that, I was like, wait a minute. Like, and then you couple that with like NSAIDs while you're on your period when it does come. And,
Yeah.
this is something we should be talking about. And then I came across the study out of Harvard showing that if you had a family history of Crohn's disease, after 5 years on the pill, you had a 300% increased risk of developing that, which my husband will attest to, puts me in a rabbit hole on PubMed. And as I went in, there were case studies from the 1970s of, and mind you, these are just like, this is just a case study, guys. So it's not a robust study, but women with Crohn's disease or ulcerative colitis, and they take her off the pill and that's it, and it goes away. And then seeing studies saying that, women on the pill that have Crohn's disease or ulcerative colitis, for every year they spend on it, they're at increased risk for an additional surgery. So for people listening, inflammatory bowel disease, Crohn's disease specifically, what I found as I started going through my patients' histories who did have Crohn's disease and did have a history of birth control, is that after starting the pill, there were many of them. I was like, did you ever have mouth ulcers? And they're like, yeah, I kept going to my dentist. I had these mouth ulcers, or they would go away. And so I just thought nothing of it. Like everybody gets canker sores. Well, that's one way that Crohn's disease can actually show up, one of those subtle things. And this is where when people say you shouldn't share the side effects of birth control because it will scare women and they should really having this conversation with doctors. Yes, but they also don't know what's not normal, and they also don't know what to be looking out for. So, the gut research has been really interesting, especially since in the 1970s. I mean, we still thought the microbiome was a bunch of freeloaders. Maybe they made a little B12 and vitamin K. There's another place to have some humility. I mean, just back over a decade ago, when I was getting my nutrition degree, we were taught that the microbiome was of little value except for some vitamins. And doctors were like, hey, you're crazy if you take probiotics, and that doesn't have any evidence. And now here we are, like,
Right.
Okay. So there was something to that. Like, we just can stay open to learning. Now, I've been talking a lot about all of the risk factors. I know a big one that people always have a question about is cancer. And a lot of doctors will recommend, if you have a history of ovarian cancer, to use birth control. And that's because birth control, the pill specifically, does decrease the risk of cervical cancer. Although, as you and I know, there's a lot more variables to cancer. It's not as simple as change your diet, and it's not as simple as taking a pill. Like, there are a lot of variables that go into that. We do see increased risk of breast, cervical, liver, and brain cancer when women are on the pill, but we do see a decrease in ovarian cancer and in endometrial cancer. And part of that decreased risk is because while you're on the pill, you can have a medication-induced withdrawal bleed. And so when you're on the pill, it's not a period. I thought it was a period. I'm like, I thought, oh, you get your period whenever you want. No, that's just a medication withdrawal bleed. So that's another, issue that we see, is that there are women with anovulatory cycles, endometrial tissue is building up. The pill may very well be the best thing to put them off, have that withdrawal bleed, so that they avoid harmful procedures, but also potential endometrial cancer. So the last thing I'll say, because there's definitely a lot more I could talk about, but is nutrient deficiencies. And this has been well documented. Whenever people are like, I'll post about it on Instagram, usually like every 6 weeks is my rotation, because people every time are like, I never knew this. And with that, there's always someone who says, I need to see research on this. I don't believe any of this is real. And I'm always a little taken back. And the thing I've explained to my audience multiple times is that when something is so generally accepted and taught in medical curriculum, you don't usually come in with a study to say, like, let's back this up. And when I was getting my nutrition degree, there was a slide that went up and it was like, hey, if you have a woman on birth control, here's the laundry list of nutrient deficiencies that she's at risk for and that you should be talking to her about diet for. Get her on a prenatal or multivitamin and be aware of this. So magnesium, zinc, selenium, CoQ10, vitamin C, B6, B12, folate. Like there are so many nutrients that birth control is depleting that alone, like if you want to use hormonal birth control, make sure you're eating a whole foods diet. Don't be Dr. Brighten, who was 17, popping the pill, owning her period, driving through fast food windows. Like, that's why I don't judge anybody about their diet, because I've done my fair share of what I call metabolic obscenities, which is I would literally cuss at my body while I ate. And so in that, I'm glad you think I'm funny, because I think I'm funny.
I do, most definitely.
But, in that, making sure and we have that whole foods diet and then bringing in a prenatal or multivitamin. And the reason why I advocate for that is because with perfect use, the pill is 99% effective. IUDs are definitely much better. Same with the implant. But, with typical use with the pill, it's like 91% effective. That means that 9 out of 100 women in a year will get pregnant. And some say 7 out of 100, but either way, the risk is there. And by the time you need folate, like during pregnancy, like it's too late. By the time you get that positive pregnancy test, you already needed folate. So if you're on a medication that is depleting these nutrients and you're sexually active, there is a risk of pregnancy, and it's for you and a potential baby that we make sure that you're supported in this way. And it's so well recognized, the folate deficiency that comes with it. They actually made a formulation of the pill that had folic acid in it to try to safeguard against that.
Interesting. So there's also a weight gain issue, kind of infamous weight gain issue that a lot of women dread. And I think a lot of men whose partners go on birth control dread. What's the deal with that? And is it true that women do gain weight? And is there concern over insulin resistance and diabetes risk as well?
Yeah, so there's definitely a concern about insulin resistance. And the research has been kind of flippant about it, where they're like, well, the risk of insulin resistance and what we see is like what we see in pregnancy. So don't worry about it. Pregnancy is transient. So anytime a research study says, it's pretty much like pregnancy, keep in mind, nobody spends 10 years pregnant. That's not something we do as humans. So with that, we saw this interesting study come out not too long ago showing that if you used hormonal birth control for 6 months or more, really any point in your life, you were at 35% increased risk of developing diabetes postmenopausal, which is really interesting to be like, wait a minute. So I stopped it, and yet later down the line, like what happened with that? And so we don't really know. And was it just birth control, or were there other variables at play? We need more research to really understand this. Now, the weight gain is interesting because I was taught, much like many doctors, no, it doesn't really cause weight gain. That's a myth. And what's interesting is you get into the research, and the way that the majority of studies have been done is that they take a group of women, they put them on the pill, they add up the change in their weight, and they divide by the number of women. Except some women lost weight because they were nauseous, and some women gained like 50 pounds. And then, so they say like, oh, it's very mild weight gain. Well, maybe, but it may not be for you. And so to that, if you're a woman who started birth control and you feel like it contributed to a weight gain, definitely talk to your doctor. And, there's a couple things at play that have kind of been brought out in the research. So one is I talked about the thyroid binding globulin and the nutrient depletions. And I have a whole adrenal thyroid chapter in my book that goes into this. And so there could be changes in your thyroid, which is your mood and your metabolism and staying warm and your menses. And so that could be really what's going on, is that there's been basically like you were probably on the edge and we just pushed you over the edge with birth control. And so we've got a hypothyroid issue. And so that's a potential. There's also the issue with muscle mass, and that if we downregulate your testosterone production and then we gobble it all up with sex hormone binding globulin, then we just took a very metabolically active organ and we starved it of the testosterone it needs to be stimulated. And what's really cool are the studies. So it used to be like, put female athletes on the pill because their menstrual cycle makes them the lesser. And which I like just giggle because I'm like, our menstrual cycle is actually full of superpowers. You people need to get in the know on this. But in this, they've actually shown that being, so that one, no, being on your menstrual, or like having a menstrual cycle, being on your period, it actually doesn't significantly inhibit your athletic performance. But being on birth control very well may, because athletes won't be able, so people who strength train, they'll find that they fatigue faster or they can't get the same gains. And I worked with a lot of athletes and women who came to me and said like, okay, so I was doing CrossFit and I was kicking ass and then I got on birth control and now something's up. Like, what is happening here? And so that could be a mechanism that's in play with that as well. And just shout out to the US soccer team, which is one of the first athletic teams to track their players' menstrual cycles and to work with them and train. So there is a way to train. We could do a whole nother podcast on how to train with your menstrual cycle, because I've worked with, I mean, being in Portland, Oregon, we've got Nike, Under Armour, like everything around that. I've worked with a lot of athletes. And so there is a way to work with your menstrual cycle. The US soccer team did it, and they actually came out and their coaches said, we think this gave us the edge. We think this is why we won. Yeah, everybody give it up for a woman's body. Like, how awesome is that? So,
I just to comment on that real quick, I've seen a few people in the fitness community publishing books lately on
really
for women specific training in accordance with their menstrual cycle. So there's more and more research being done on that in the last few years, especially.
Super cool. I would definitely want to check that out. Yeah. And it's also something too for women. If you're like, wait, I got to like it's enough to track when my period's coming. Now I got to figure out when to exercise. You know this intuitively, you know this, you're just not giving yourself permission for it. So you already know, like the week before your period, you start slowing down and you're like, why can't I go so hard in my spin class or CrossFit? Because girl, you're supposed to be in yoga and Pilates and doing these other, like, just give yourself permission. And, as you're nearing ovulation and your testosterone is ramping up and you're like, I know I'm only supposed to run 5 miles, but I feel like I could run 10 and it would feel awesome. Try it. Like, just, this already. It's just, we get so dogmatic about things and we think like, and then we also get in our heads about like keeping up with men and keeping up with the other gal and like, no, just be in your body, be present. You've got this. You already know this. So the last piece I want to say about weight gain, which is the most common, is water retention. Because birth control, so interestingly, they have taken women's blood, put them on birth control, and found that CRP, so C-reactive protein, a marker of inflammation, is elevated after being on birth control. It is inflammatory, and inflammation is as bad as it sounds, you guys. It makes rigid cells that don't accept hormones, but it also can cause you to retain water. So you can have this water weight. Progesterone, which is made after ovulation, is a diuretic. Progestin is not. So now you just lost your natural diuretic. And so that is like the most common in terms of what we see. And so I just want to say that right now, the studies are concluding that like there is no significant weight gain, but that might not be true for you. And that's more important than any study, is what is true for you. And people are experts everywhere. Like, it's a myth, shut it down. Why? Because it's one of the biggest barriers to women starting birth control. It's one of the biggest things that they are afraid of happening to them. And so I think that we can have that conversation and then and do it in a way that isn't scaring women and at the same time isn't trying to basically brush it under the rug as if like, no woman's ever experienced weight gain. It definitely happens, but the reasons, they're complex and we definitely need more research.
Yeah. So what is post-birth control syndrome?
So like all syndromes in medicine, it's a collective of signs and symptoms that tend to run together. And with post-birth control syndrome, it's really my hope that in 20 years, it's the condition formerly known as post-birth control syndrome, so that we've done more research, we've collected more data, and we are like, this is actually what's going on. Kind of like IBS, irritable bowel syndrome, which, for people who are not familiar with this, once upon a time it was, you have IBS, you stress too much, and you're just an anxious person. And then it was like, wait, you have IBS-C and IBS-D, which is IBS constipation, IBS diarrhea. And now it's, wait, you have small intestinal bacterial overgrowth, which is secondary to a transient autoimmune attack on your migrating motor complex, which is the nervous system of your digestive tract. And so now we're starting to understand there's a lot more to it. And that's how we start with this syndrome. So in
Mm.
post-birth control syndrome, number one criteria is you have to have been on birth control. And when you come off, you can see these symptoms and these signs start to rise. Typically, on average, we'll see 4 to 6 months after stopping. For some women, it's much sooner. For other women, it's much later. And the women that are much later is usually because they've been powering through. That's what women do. You know, your wife just had your second baby.
Mm-hmm.
We're amazing like that. And
You
you
are.
power through and you put your head down and you're like, I can handle it. I can deal with it. I don't have time to go to the doctor. And before you know it, you're like, I can't handle it. I have to go to the doctor. So with that, when you understand that every single system in your body is impacted by birth control and that every single system in your body has receptors for these hormones, you can understand how when you come off of these hormones, these systems can start to speak up. So we can see missing periods. I've had women who have had regular periods for a decade. They were like, yeah, I counted it down and I dreaded it. That was me too. And then they got on birth control. They did it for several years, sometimes 5 years, sometimes 10 years, and they come off and they lose their period. And their doctors are like, well, this is probably how you always were. No, something else is going on there. And interestingly, so if you are a woman who comes off of birth control, you lose your period. If it's been regular, we expect it to come back 3 months after coming off of birth control. If it was irregular, it could take up to 6 months. But in my practice, I say, if we're on month 2, it's time to start thinking about lab testing and working that up because, once we get into, and it's just about timing of labs. We don't want to be at month 6 being like, oh, shoot, we had hypothyroidism and now everything's going downhill. We want to look for that root cause. Now, the other thing is that we can see digestive issues start to come up, gallbladder issues coming up, new onset neurological issues. So you may develop headaches or migraines for the first time in your life, brain fog, anxiety, depression can set in then. We can also see weird skin symptoms, not just acne, but I've had patients come in that are like, I have idiopathic hives now. And I'm like, okay, let's go through your timeline. What changed? I came off of birth control. 2 weeks later, I started to have like these little rashes. And then, next thing I knew, 2 months later, I've got hives that break down out. And so it's just something that like we have to start asking the question about everything we haven't been asking the question about basically with birth control. I mean, there was just a quote in Scientific America from a researcher who said, we haven't been studying the female brain and what happens when we leave women on birth control for decades. And she called it the, biggest, longest uncontrolled trial that's ever existed. And it really is. And, people get really pissed at me for talking about this. And I get it. It's inconvenient. It's a very inconvenient discussion. And if you're having a moment where you're like, what the heck did I do? Know that I went through that. Like even in writing this book, there were times where I was crying because I was like, I've prescribed birth control. I have taken birth control. I didn't know any of this and feeling really guilty of like, how did I not know this? And I did this to myself. But the thing is that you don't know what you don't know. And the trouble is that research hasn't asked a lot of the questions for us to actually know and understand what's happening.
And that's a scary thought, I think, to realize that also if it's not just you that didn't know, it's 95, I'm guessing, percent, at least, if not more like 99% of doctors that are prescribing this probably don't know a lot of the science around the side effects that's presented in your book. Would you say that's accurate?
Yeah, I don't know about that statistic, but there is a lot. And I've had so many OB gynecologists reach out to me being like, I've changed the way I practice now. I just had a gal the other day write me and she's like, I've been practicing 30 years. Do you know how many birth control prescriptions I've written? And like, I'm actually now talking to my patients about like, you know what, let's actually work this up. Before we go down that route, we have other options. So I think we are seeing a shift and that's something that like brings a lot of hope into all of this. But the other thing I will say is that and I say this in my book, so you might have read it already, is that sex ed was an epic fail. It's an epic fail for me and for so many women. I mean, there are so few states that actually mandate scientifically accurate sex ed. Like, let that sink in. they can teach you whatever they want, but it's based on science. I'm like, what world am I living in right now? And, with that, what drove me off the pill. One is that when I started it, my doctor said 10 years, that's all you got. Then the risk of breast cancer is too high. You have to be off the pill, like no more than 10 years. So when 10 years came, I was sitting in class. I remember I'm in Nashville Medical School, and they say, and this is when so many women figure out how their body works and how ovulation works, is infertility. And when you want to have a baby, and they say a woman is only fertile one day out of the month. And it was like this panning in moment. Like if I was like on The Office or something, and it was like suddenly the camera's on me, and I'm just like, what did they just say? And I'm like, and I had this moment where I was like, you shouldn't have to go to medical school to understand how your body works. Like, all of these women are like half the population walking around in their body and have no idea when they're fertile, what's normal cervical mucus, like what a period should be like. And that was something that, like, I mean, I really set out to do in the book, is like, let me teach you about your hormones. Let me teach you about what a menstrual cycle looks like. Cause I didn't know that until we were learning about it, because we had to help women get pregnant and troubleshoot these things and have a diagnosis. And that's just not the way it should be. And I think, I think there's a lot of great doctors out there, but I've also talked with, women who've said, like, my doctor said, there's no reason, I'm on birth control, there's no reason to test any hormones whatsoever, because they're all suppressed. And I'm like, did you say anything about like thyroid or cortisol or insulin? And like, they were like, yeah. And they said they're all suppressed. And I'm like, okay, I don't know if you misheard it or what's going on, but like, you'll hear kind of these things. And that's what I was talking about, like these myths. Like, there are these myths that continue to get perpetuated. They get perpetuated by influencers. They get perpetuated by doctors. And like, that's really like, it's why, my good friend, Dr. Sarah Hill, and she's a researcher doing research on birth control. And we've had this conversation about how, she said this really profound thing, that doctors expect that everyone will have the same response to drugs. And when they don't, they dismiss it. And the science doesn't support that. It just doesn't. The science shows that, like, we actually can't predict how the population as a whole will actually, be affected not only by a drug, but by diet, by exercise, by sleep. Like, we're just not there to be able to do that. And so we just have to hold space that, like, the pill and all of these forms of hormonal birth control are awesome medical inventions, great devices that we see come out. However, like, it's not the end of the conversation. We have more to ask. And I think about things like, the e-shirt coil, and how many women did it take until that got pulled? Are you familiar with that medical device?
No.
So it's, I briefly talk about my book because I was like, I can't recommend this to anyone. So it's a coil that they would insert into the fallopian tubes, and basically scar tissue would form around it, block the tubes. No sperm gets through. Except that in some women, it basically became shrapnel. And these pieces were floating around. Women were losing their uterus. It's just so many complications from it. And when you go and you look it up and you read about it, one of the biggest reasons why they finally took it off the market was because the demand was going down, and because people weren't buying it, which is to say, your dollar vote is very powerful, people. But also, it's just like, how many women did it take before we were going to recognize this was an issue? And that, medicine's not perfect. Human bodies aren't perfect. Like, we're going to have flaws in methods. We're going to have flaws. We're going to have people that are outliers. And yet at the same time, I mean, that's a lot of the work that I'm doing, is that I just don't think we can afford to lose any more women to a side effect or a complication that could have been screened for or avoided. And we have the science, we have the ability. I feel like it's we have the technology to build the bionic man. And I just dated myself there. So if anybody's like under 30, they're going to be like, what the heck is that? But it is something that I think, like, the time to believe women's stories is now. Actually, the time to believe women's stories is yesterday. And, as people keep dismissing the side effects of birth control and shutting down women's stories, I just think, how many is it going to take?
Yeah. Now, again, given that there are so many doctors who aren't listening, given that there are so many doctors who are not well read on a lot of these side effects that you talk about in your book, kind of going back to a conversation you and I were having just before I started recording this podcast, one of the things you said is, we were talking about some controversial issues and how rather than getting yourself in hot water on some of these issues, you just will recommend to people, hey, go talk to your doctor about it. Well, how much sense does that make here when so many doctors aren't listening and don't know about this stuff and are likely to be the ones that just say, oh, you have this symptom, here's birth control, without any digging into the root causes? So to rephrase this question, for people who are on birth control now or who are considering it due to some symptoms that they have, irregular periods or heavy bleeding or hormonal migraines and things like that, what do you recommend to those people, given that it's not just as simple as go talk to your doctor?
Yeah. Okay. So this is a great question. So one thing is I recommend that everybody tracks their data, go through one menstrual cycle. When you write it down, it's very hard for someone to gaslight you. So what will often happen in a practice, and there's research to support this, is women go in and they say, this is my experience. And a doctor says, I don't think you're right. And then there they are in their white coat, their stethoscope, they're doctoring. My doctor probably knows more than me. So if you write it down and your doctor says, I don't think that that's accurate, that's your experience, and you look down and you're like, yeah, no, I wrote it down. It's a lot harder for your doctor to do that. And you can advocate for yourself. Now, in addition, quantify that data.
Isn't that amazing, by the way? That it's like, if you speak words, they're like, I don't know if that's legitimate. But if you've written it down on paper, they're like, oh, looks legit.
That's how we roll, though. We write everything down. So we're like, oh, that's legit. Like you wrote it down.
Yeah.
So, with that, we want to write everything down for sure. We want to get a gauge of what is normal for you and quantify it. So don't say, I have heavy periods. Actually, how many tampons do you change in a day? How many times do you change your menstrual cup? Like, do you have to get up and change a pad during the night? And I go through all of that in my book. So we want to get the quantifiable data for sure and take that to our doctor. And if we are going to consider starting birth control, getting some baseline labs as well. Like you get a CBC, a complete blood count. If you're already B12 deficient, iron deficient, like you want to know that before you start birth control. Otherwise you start it, now it looks like you have a B12 deficiency. Was that because of birth control? Was that already where you were? Mm-hmm. And also getting things like your cholesterol checked, because as I said, birth control can elevate that. Getting your blood pressure checked by your doctor, that's pretty routine. Getting a thyroid panel, your inflammation markers, a homocysteine. So I go through all this in the book. And then I recommend that if you have the medical intervention, circle back and retest and continue to track your data. There's lab data. I love it. It's very objective. However, there is the data you have that you walk around in your body with every day that we can't capture in labs. So it's very, very valuable to bridge those two together. So that way, if you end up with birth control side effects, you've tracked that data and you can be like, yeah, nope, this is different. Like this is not working for me. Can we do something else? And that's how we get a little more to that individualized approach. Now, if you don't want to use birth control and you want to figure out like what is going on, that is something that I guide you in the book of like going to your doctor. And rather, there was this movement, I feel like it was a little bigger a few years ago, but it still exists, where it's like your doctor works for you, go tell your doctor what to do. Don't do that to anybody in the world that you want help from, because it just doesn't work. That's just human politics.
Yeah.
It's not just a doctor thing. So with that, going to your doctor and telling them, for example, I have irregular periods. My periods are coming anywhere from 35 to sometimes 60 something days. I can't predict it. And I'm just wondering, like, could this possibly be due to thyroid issues, or might you think that I have polycystic ovarian syndrome? What lab testing could we do? And then have a list of labs that you would like to see done. And as they say them, check them off. And if they don't say some, ask about it. And if you come from it in an inquisitive way, recognizing this person ultimately wants to help you, you're going to get a lot further in that visit. Now, you will meet doctors. It's not uncommon, especially in the United States, for women to go through 5, 6, 7 doctors before they get one that listens to them. That's sad statistics, and it needs to change. And I think it is changing with the newer generations of physicians who are graduating. But don't be afraid to get a second opinion. Like, your doctor can't be everything to you. I mean, that's why I advocate, like, if working with like a registered dietitian or a nutritionist and like other people who can be allied providers. Your doctor isn't going to know everything about nutrition. They know things about you not dying. That's really important too. So everybody has their strengths in that. But, in that, if you need to see a different doctor, see a different doctor. I've had great experiences with male gynecologists personally, and terrible experiences with female gynecologists. And on the flip side, but I hear a lot more that women say, like, I feel like my female doctor listened to me more. That might be true. I think it's a lot easier to empathize with someone when you also bleed and you have cramps and you're like, I hear what you're saying. I've been there. But at the same time, I don't necessarily think it's totally rooted in gender. I think it's more rooted in education and, the stories. I mean, really the stories that your doctor's been told about a woman's body. And that's an important piece right there. These are all just stories that we can rewrite, you guys. We can change the narrative in this. So there's those pieces. I also recommend, if you can find a naturopathic physician, you can go to naturopathic.org. That's the American Association of Naturopathic Physicians. Look there. If you can find a functional medicine doctor, so ifm.org is another great resource to try to find a clinician that will work with you that's more about the root cause. I like to use this analogy of, like, when patients tell me, like, I went to my doctor, was so frustrated because I want a root cause medicine, and like, I just got these acute solutions. I'm like, you essentially went to the sandwich shop and you asked for ice cream. And then you both got frustrated because you're like, I want ice cream. And they're like, I make sandwiches. That's what I do. And what you really needed to do was go to the ice cream shop and you would have been satisfied. And so with that, it's not that your doctor's bad. It's just that they do sandwiches and you're looking for ice cream. And so we have to seek out the provider that's going to meet our needs. And so it's just like, you wouldn't go to a naturopathic doctor, even a functional medicine doctor, and be like, I have this major surgery I need to have done. No, you want to go to the surgeon for that. And so it's a bit of navigation on your part. You can find these providers. They do exist out there. And I'm not an advocate of just DIY everything. I put out a ton of information as I say that. I put out tons and tons of free information about lifestyle and nutrition and, supplements, and I put out information about lab testing as well, and pharmaceuticals to talk to your doctor about. But in all of that, you really do need a partner in this arena. And there are, a subset of people who will be like, I did the diet, I did this, I did that, everything got better, fantastic. But if it is something like endometriosis, you don't want to go it alone. You do want to have allies.
Yeah, and always, at least, even if you are going to go it alone, it's always smart, if you have any kind of severe concerning symptom, to at least rule out potentially diagnosable conditions that they do have good treatments for.
Yes. Can we just do a medical disclaimer here that right now you cannot diagnose or treat yourself on the internet. It doesn't work, and neither can anyone else. And I see that sometimes on Instagram, where people will be like, you have this and you need to just take this. And I'm like, off of one paragraph? This person wrote one paragraph. Like, I will spend an hour with them just figuring out what we're going to test next. But okay. Yeah. So don't just take it and run with it, guys.
There is a flip side to this, though. And I can't speak to everything, and I certainly can't speak to a lot of areas within your specialty, but within fatigue specifically, there's actual statistics, there's evidence-based guidelines published in a peer-reviewed journal talking about lab testing for people that come to the doctor's office with fatigue. And in those evidence-based guidelines, I mean, they give specific guidelines for practice, but they also talk about lab testing. And they say, here are the recommended labs that you should run with your patients with fatigue. And they also say a couple times in there, 95% of the time, they won't find anything on those lab tests that will change any of their recommendations. So in other words, less than 5 out of every 100 people actually get, let's say, oh, we found anemia. Oh, we found hypothyroidism. The other 95% of people are told you're perfectly fine based on your blood test. So to some extent, I would say a lot of people are going it alone, whether they tried to or not. They're even if they went to the doctor and got the tests and wanted help, they still end up going it alone.
That's totally fair. And it's true. But at the same time, you did get the screening labs, because
Yeah.
what if lo and behold, it was 21 hydroxylase antibodies positive, ACTH is through the roof, and your cortisol is dropped? Like, we're heading towards an Addisonian crisis. That's super rare. But you don't want to find out that you were the like canary in the coal mine kind of
For
situation.
sure. Yeah.
But yeah,
Always smart to rule out the severe stuff.
totally rule it out. But at the same time, I think too, when you start to look at the research, I mean, it baffles me how people are like, food's not that powerful and all these things. And I'm like, except there's studies that come out that say that like the majority of the conditions we are all suffering and struggling from are diet and lifestyle based, and that we could prevent it. And so it is something too that I'll say to people, just like, you don't have, like, this day and age, you don't have to be like, I'm either going to take the pill or no, like I'm going to do the diet. You can do both. And when I call it like, I like to say, it's like going to the tool shed and you need a hammer, but you just decide you hate hammers. You just hate hammers. So you're going to use a saw again. Is that going to get the job done? It's not going to get the job done. So if you need a hammer, take the hammer, and hey, you can tow the saw around too. But, it's something that I think we have to recognize, that the majority of healing does not happen in the doctor's office. What keeps you out of the doctor's office and what heals for life is generally not going to be coming in a pill bottle or any of these other things. Yes, it's great that we have these pharmaceuticals. Yes, it's great that we have surgeries, especially life-saving ones. We can use those, and we can also take ownership of our own body and personal responsibility for getting to bed on time, for making sure that we are eating nutritious food as often as possible, opting for that nutrient density, making sure that, like, if your life is really, really stressed out, you are setting boundaries and saying no more often, not taking things on. I also think, like, at this juncture, I'm like, I think we all need mental health support. Like, we really do. And whether that's community, some people find it in a church, some people find it in a drum circle, some people find it in a licensed professional's office. But I do think that we need that mental, emotional support. And I think community can do a lot with that as well. I think that's kind of the next frontier where we're going to see everybody start talking a lot more about, because I think social media kind of created the most socially isolated humans in some way, not by design. Although I do have this theory that, please don't censor us, Mark Zuckerberg. This is just a theory. I do have this theory that I'm like...
It's just a theory, I swear.
It's just a theory that, so my husband's in tech. I've hung out with a lot of techies. They're not always the most sociable people. There are outliers. I'm not making generalizations, people. But in that, I wondered if, like, Mark Zuckerberg was actually really awkward at parties, didn't like talking to girls, that kind of thing, was like, what if I put a screen between her and I? Like, what if we actually made communities where it's online and it is easier, right? Because you can filter yourself before things come out of your mouth. Not everybody does that so well on social though these days. That's kind of my theory, is it was a way to actually build community for people that kind of had trouble. And I'm guys, I'm not above Facebook. I'm an early adopter. I was in college when it came out. As soon as they opened it up to other college students, I was all over it. I was like, I still love you, MySpace, but let me do a little Facebook. So I don't hate on social media, but it is something that I think is, I think it's really interesting. A friend of mine was just telling me there's like Snapchat dysmorphia now, where people are wanting plastic surgery because they believe their faces should look like the filters in Snapchat. So it's a trip. I want to see more research. I want to just go to a conference on like social media's impact, like the other great human experience. So I'm fascinated by it. And as I talk to you about it, I'm like, talk about fatigue. Scrolling.
Yeah. I was, there's so much I want to say. First of all, I totally agree with what you said about community. I think that's huge. I think, it's absolutely true with social media. There's all this weird aspects of human psychology that are born into the world as a result of being separated from even just a face-to-face encounter, real-time encounter like we're doing electronically right now. But then you take it one step further of separation. Now you can do stuff anonymously. There's no picture even oftentimes, and you can comment on YouTube. I mean, YouTube is notoriously kind of a cesspool of negativity and nasty comments of people just saying,
Are we going to be on YouTube?
we are going to be on YouTube, but I don't get those, like, generally speaking, I don't get these kind of like, like, if you want to see an example of this, go on like Joe Rogan's podcast and look through the comments and, you know, or anything political, and you will just see people writing the most nasty, insane stuff that they would never say in person.
I would never say. I have to say, to quote Taylor Swift, oh my God, that just came out of my mouth. But she has this, there's this song I was listening, I just got into Taylor Swift because this song came on and I was like, that is such a good song based on the lyrics. And then lo and behold, it's Taylor Swift. And she's like, if you say it on the street, it's a knockout, but you say it in a tweet, that's a cop out. And I'm like, oh, that is so very true, because you wouldn't say it to someone's face. I'm known as being I don't run away from conflict person, and I'm not very good with passive aggressive. So I just don't understand it is the reality. So I'll just be like, I don't understand. Are you mad? Are you saying you're mad? Like, I need to know. And it is something I think that one of the most toxic things we can do is start an us versus them camp in our life. And you can't control anybody else, but you can control yourself and see the humanity in everyone. And if you don't like someone on social media, you can say, no, thank you, not for me, and you can walk away. However, I think that, it's definitely something too that, I've come against with birth control. I've come up with the food is medicine community. All of these people being like, it's us versus them and us versus them. And I'm like, when in history has that ever worked out, you guys? Like, not to be like doomsday, but as we sit here on this planet, we are coming up against some really scary stuff and quick. And I'm like, you guys, the way forward is together, and we've got to get it together quick. But I'm with you that us versus them, it's toxic and it doesn't move us forward. It's counterproductive, and no one's going to listen to you when you're screaming at that. I don't even understand it. I'm like, this is where we need to like third party in, like someone who knows brain physiology, and be like, what kind of hit are they getting in doing that? I can't imagine.
Well, actually, that's the other thing I was going to mention real quick. I just recorded a podcast with neuroscience expert and psychiatrist. You may actually know him, Reef Kareem.
Oh yeah.
Yeah. So
he does a lot with addiction. Hello, social media.
So we actually talked quite a bit about social media and how that's killing people's creativity and motivation and mood. And so very much to your points there. The last thing I want to say, or the last thing I want to ask, is just to loop back really quick. And I would love, this is a huge topic. So I would love just a super succinct answer, just to kind of
stop being so loquacious.
Just so because I know we're already over time here, and I'm opening up a massive topic, and I just know that I don't expect you to give an hour-long lecture here, but more like a 2-minute kind of overview. I want to loop back to this idea that you talked about a few times in this podcast and in your book, about the fact that so many times people are not addressing root causes of these symptoms, whether it's irregular periods or heavy or light or whatever the symptom is, or menstrual migraines and things like that. The subtitle of your book is a 30-day program to balance your hormones. So I want you to just speak to that really quick, that because we didn't cover it in this podcast so far, just the fact that you have a whole bunch of information here on nutrition and lifestyle strategies that you can use to balance your hormones and actually address the root causes.
So it's always, in my world, it is food and lifestyle first, supplements second. I really want to bring that in because there's a couple supplement tables to help women, but I don't want anyone to think like you can just out supplement a poor diet and lifestyle. Like, you have to have those foundations in place. When you do, supplements are like rocket fuel. You will just take off. And so I outlined a 30-day program. Now, I am very clear in the book. It is likely going to take more than 30 days for you to reverse all these symptoms. Now, I'd like to be really clear because I don't like false expectations. There are people out there that are like, oh, you can change all of your hormones and fix your period in 7 days. And I'm like, but your cycle is like 25 to 35 days. How's that possible? So, with that, it's 30 days of really being, you're basically testing. So I'm getting you to build your own user manual. And after 30 days, you're going to reintroduce foods. You're going to reevaluate. So we've got quizzes to reevaluate your symptoms. And then you get to decide from there. So I made it very choose your own adventure. And then from there, what was serving you? What do you want to continue? What do you think is going to help the most? And there's a lot of things that I teach you in the book. So safeguarding your circadian rhythm is a non-negotiable as a human, but definitely as a woman. I mean, there were studies back in the 70s showing how light actually impacted ovulation, our fertility, our cycle. And what was interesting at that time, they were like, and there's so much light pollution that like a ton of the US and the UK don't even see the Milky Way. And I'm like, hi, 2019, it didn't get any better. It's the reality. So with that, we have, these really lifestyle practices you will carry with you. So safeguarding your circadian rhythm. Yes, you will go out dancing one night. Yes, you will find yourself in an airport. Things will happen in life. Never about perfection here. You're definitely going to want to eat in a way that matches your body's needs. I ask you to come into this through the lens of how much is my current diet serving me, and like how much did this protocol help me, so that you can really navigate that. I've had women who are vegan who are like, after I went through the book, I realized and then I got lab testing that this diet wasn't working for me. And then I've had other women that were like, I actually ate less meat and more plants and I felt a lot better. So it's about what is true for you. That's your lens to carry with you. And then, through the book, I'm also going to teach you things of like how to support your gut health, how to support your adrenals, your thyroid, and your mood, your libido. Get your libido back and enhance your fertility. Whether or not you want to have a baby, it's going to help your hormones big time. And the way I really wrote this book was to be a user manual that travels with you for life. And I saw there's a lot of hormone books out there, right? But how many of them were talking about birth control? And I was like, where's this missing piece here? So, it does have birth control information and it has everything else you need to know as a woman to really navigate this life. But I didn't want to write a book that you picked it up, and I'm sure you've had these health books where you pick it up, you're like, that's interesting, you do what's in it, and then you're like, okay, moving on. I really wanted it to be something that if you invested in this book, that you were able to pick it up off the shelf and go back to it over and over. You find yourself 2 years later and you're like, what is going on right now with my hair? Pick up the book. It's in there. You can start troubleshooting and get to your doctor. And so in this, it is a 30-day protocol with a meal plan, recipes. I'm a foodie, so I don't mess around. I don't like bad food. This is like anybody who's in my personal life and shares a meal with me. They've probably heard me say it before. If they're listening to this podcast, they might eye roll. But I'm like, I only have so many meals left in my life. And I also practice intermittent fasting. So I take this very seriously. Like I love food and it needs to taste good.
I practice time restricted feeding such that I only eat one meal every 3 days. So that by my count, I only have 38 meals left in my life.
Oh my God. No, it's nothing like that. And I also work with my menstrual cycle with intermittent fasting. And guys, I am at a stable place in my health. And also if I feel stressed out, really tired or really hungry, I don't care. I eat the food and I honor my body. But with that, the meals are really tasty. I have to say there was the cutest photo that someone put in my Facebook community. And it was like, I'm a sucker for man buns. I'm just going to say that. Man buns and a beard. If you're hairy, that's my jam. And he's like man buns, man bun, beard, like cooking a meal in the kitchen. And she's like, my husband wanted me to tell you that your meals are his favorite. And I was like, yes, man bun approved. She's probably listening right now and being like, were you checking out my husband? No, my son's 6. He has a man bun too. Not just but yeah, so that's the 30-day program. Know that it is meant to teach you how to build that user manual and really your guide to you and how to work with your hormones for life.
Yeah. Beautiful.
That wasn't concise. I just went off forever.
It was perfect. Thank you, Dr. Brighten. Thank you so much. Thank you for the extra time here, taking extra time out of your day to do this and share your wisdom with my audience. I know this is going to help a lot of people. And on a personal note, it was a lot of fun. So thank you so much.
This was seriously one of the most fun. This is in the like top 5 of the most fun I've had on an interview. So thank
for
you.
me too. Yeah, thank you. Have a great night.
You too.
Hey guys, one more quick thing before you go. I just want to remind you again, you can get this book, Beyond the Pill, on Amazon. I highly recommend it. Whether you are a woman dealing with these issues or you're just looking after the women in your life, get it as a gift for them, get it for yourself. You need this information. So go to Amazon and grab this book, Beyond the Pill, Dr. Jolene Brighten. I hope you guys enjoyed this podcast, and I'll see you next week. Hey there, this is Ari again. One more quick thing before you go. Just make sure to subscribe to our YouTube channel, The Energy Blueprint, and also make sure to subscribe to this podcast on your favorite podcast platform, whether that's iTunes or Stitcher or anything else. I hope you guys enjoyed this interview, and I will see you again next week.